So welcome back to Monitoring Clinical Trials here at Wake Tech. My name is Steve Pope, and this week we're going to be talking about advancing your monitoring skills. So to get started, I want to go back and go over our purpose, which is comes from ICH, which is the selection and qualifications of monitors. So it's important that we understand this. So we've gone over this before, but I want to go over it again. So monitors should be appointed by the sponsor. And then monitors should be appropriately trained and should have the scientific and/or clinical knowledge needed to monitor the trial effectively, adequately. A monitor's qualifications should be documented. And then finally, monitors should be thoroughly familiar with the investigational product, the protocol, written informed consent form, and any other written information to be provided to subjects, the sponsor's SOPs, good clinical practice, and the applicable regulatory requirements. And of course, this comes from ICH E6 R2 section 5.18.2. So that's going to kind of lay the foundation for what we're going to talk about in this lecture. Our learning objectives include discuss the changing role of monitors, and some of you are already understanding that from the previous content. We're going to discuss methods of advancing and improving your monitoring skills. We're also going to cite additional training resources for monitors. And then finally, we're going to discuss how to assess your progress in expanding your monitoring role. So let's discuss the changing role of monitors. So by this point, we've all heard of risk-based monitoring, and we've also had a module earlier in our course on the central monitoring role, sometimes called remote monitoring, so you're already familiar with that. So that's one way that the role of monitoring is changing. We're doing a lot more work that is considered monitoring, but doesn't involve actually physically going to the site. So that portion of the monitor's role has changed quite a bit, really in the last probably 3, 4, 5 years or so. One thing to keep in mind is that these trials are becoming more complex. And by that I mean the protocols are more complex. There are more vendors involved, which gets us to our next point. They're adding more complexity to trials. And so as a monitor, you're going to be required to go into vendor portals, which would include your EDC vendor, your IWRS vendor, which may or may not be the same company. You may have a laboratory portal that you have to go in and review lab results. You may have a photo vendor where if it's like a dermatological study, subjects might be taking photographs, and so that may be something you need to go into. You also may have special medical procedure vendors, such as a vendor for your ECGs or for spirometry if you're on a respiratory study. So you may be required to go into these sites, and that's going to require login and password information. So there's going to be a lot of different things to keep track of in these more complex trials. And so that brings us to our fourth bullet item here, which is greater expectations of competency. So as we talked about in our first slide, monitors have to be considered qualified. Well, what does that mean? Well, that means a number of things. It means the training that you come to the table with initially, but it also means how you keep your skills sharp. How often you improve your GCP knowledge. Do you have specific training that may be therapeutic oriented, or that may be oriented around a particular vendor that you're using? Those are things that we have to pay attention to, and they really add a lot more complexity to the trial. So one of the things I want to talk about in the next slide is going to be the Joint Task Force diagram that I'm going to show you here in just a minute, because I think it's going to expand upon that. So this diagram that you see is one that you've probably seen before, and it comes from the Joint Task Force on Clinical Trial Competency, and it consists of these 8 domains that you see in front of you. So this consortium was created by those that are involved in academic training programs and clinical research. There are also some other individuals involved in this task force. And so what they did is they came up with the major knowledge domains that every clinical research professional should have. And so if we go through these, number 1 is scientific concepts and research design. There are a lot of good ways to learn more about that, but understanding the trial design and things like that are very important. Then 2, you've got ethical and participant safety considerations. We learn a lot of this in our GCP training, and we've learned some in some of the foundational training that we've gotten over the years. Number 3 is investigational products development and regulation. How does a product go through its development cycle? What are the regulatory ramifications of that? Number 4 is clinical study operations, or GCPs. What do we have to do to get our study off the ground and to implement it and to make sure we're operating it within the regulatory requirements for our study? And then number 5 is study and site management. This is a very important one, and you're going to be heavily involved in this in your role as a monitor. So you're going to be involved in working directly with your sites and managing some of the efforts that they're going to be involved in. Number 6 is data management and informatics. This is not solely for those that work in data management. The more you understand about that, the more capable you're going to be as a monitor. So if you have the chance to learn more about those concepts, I highly encourage you to do so. Number 7 is leadership and professionalism. We're going to touch on that a little bit later in our lecture, but essentially, how do you view the profession? How do you increase your leadership presence not only within your company but within the industry? And then finally, number 8, communication and teamwork. That's very important. We work on study teams with a lot of other individuals, and being able to communicate effectively and work as a team ensures our success. So these are the major competency domains that everyone that works in clinical research should have familiarity with, and this is something that you're going to build your expertise in, as you continue throughout your career. Next, let's discuss methods of advancing and improving your monitoring skills. So the first bullet item here is to become a site manager rather than a simple auditor. And by that I mean a site manager is going to be vested in the success of the site. We want our site to succeed. We want them to feel good about working on our trial. This would be some of the key performance issues, such as subject enrollment. Are they meeting targets? Are they reducing the number of deviations that you're finding when you're going out and monitoring? Are you reducing the number of questions that they have? And so working as a site manager, helps you think of yourself as a member of that site, and your overall goal is to help them succeed. And that may require some specific things from you as a site manager. So you want to view the site from the trial management perspective. From that, I mean, how is our site performing versus the other sites on our study? And these would be performance metric areas, such as, are they entering data as they should? Are they answering queries in a timely fashion? Are they meeting enrollment expectations? Are they meeting the expectations we expect for the number of deviations that we're finding? All of these things are things that we should be able to measure as we go throughout our trial, and measure our site against other sites and see if there are areas where we need to help them improve. And then finally, as a site manager, we want to anticipate issues and risks, and we want to anticipate certain problems that they may have. For example, you're going to learn things from monitoring your other sites that you may be able to share with another site that you're monitoring. A good example, I had a site once, and I noticed on their delegation log they only had one person that had IATA training for sending in and shipping lab samples. And this person happened to be a pharmacist. And so I questioned the site about it and learned that the woman who was the pharmacist thought that this was training that the site had to pay for, and so therefore the others had not gotten it. Well, I told her, look, there's lots of free training out there for IATA specifications. One in particular is from the Mayo Clinic, and you could get everyone to go through that training, and then they would be certified. They'd have their certification for IATA training, and they would help you in processing these lab samples and making sure they're getting to the right place. So that's just one example of how you can take what you've learned from one site and help another site improve their performance. One thing that I like to do is I use a lot of Outlook reminders to help prompt me to follow up on things. For example, if I'm going to be asked to provide a site with a listing of queries that have recently fired, then I'm going to put maybe a weekly reminder in my Outlook to make sure that I do that every week. So these are ways that you can anticipate risks, anticipate issues, and help your sites be more successful. So let's cite additional training resources for monitors. So everyone comes to the monitoring role with kind of a different background. And so it's important to understand that your learning doesn't stop. Once you get into that role, it needs to expand. And one way that you can do that is through some of the academic programs that are available out there in our field. And these could be at the bachelor's level or the master's level. And I've listed a few of them here. University of North Carolina at Wilmington has a great program, a BS program, and an MS program. And since they're a state school, it's a lot less a lot less costly than some of the other programs out there. Campbell University is another local school that offers similar programs. George Washington University has both a bachelor's and a master's program. Also Drexel, which is based in Philadelphia, has a similar program, and so does Ohio State. Most of these programs are delivered online. However, some of them offer classroom training if you feel like you need classroom training. However, I think you'll find that the online programs can be just as effective without the added cost and time commitment of traveling to a classroom. So I would encourage you that some of these programs will be very beneficial for you as you move and as you progress in your career. So certainly check them out and maybe think about which one may be right for you. Let's talk about the professional development organizations from our industry. There are two in particular that I think are very beneficial. The first one is the Association of Clinical Research Professionals, or ACRP. This is the larger of the two. It's an international professional development organization. There's a chapter right here in the Raleigh area that holds monthly meetings. And you can go to their website and you can find out when the meetings are held and you can participate. You don't have to be a member to go to the meetings. In fact, I recommend that you just attend a few of them and meet some of the folks and then decide later if you'd like to join the organization. ACRP offers two certifications that I think are particularly noteworthy. The Certified Clinical Research Associate and also the Certified Clinical Research Coordinator. So one would be for those that are monitoring trials, that would be the CCRA. The CCRC would be for those who are coordinators working at a clinical site and they're doing the coordinator role at that site. It's important to understand that there are work requirements necessary before you are eligible to sit for these exams, and you can look on the website and determine what those are. And normally they'll require at least a few years of work experience in a specific role before you're eligible to take the certification exam. The other organization is the Society of Clinical Research Associates, also known as SOCRA. They have a certification called the Certified Clinical Research Professional, which is similar to the CCRA and CCRC, a little more regulatory oriented. But once again, this organization has a local chapter here in the Raleigh area that holds local monthly meetings. So look them up online and find out when the next meeting is and plan to attend and meet some of the folks there, and then determine if you want to join that organization. Once again, the CCRP certification does have a work requirement, so you can find out what those requirements are based on their website. So I would encourage you to think about possibly getting one of these certifications as you move forward. That helps people that you're dealing with know that you're taking the time to become certified in your field, to advance your training. It gives you a little bit more prestige when you're out there working with people in our field. So I highly encourage it. And then finally, as a training resource, we have company-sponsored training and also private training programs. The way these differ, obviously one is offered by your employer, and these could be, if you're working at a CRO, you might have some type of CRA academy or CRA training program for those that are interested in becoming CRAs. And so that may be something that you want to consider. Many of you are working at CROs now, and if you want to get into that monitoring role, probably the most effective way to do that is to participate in one of these company-sponsored training programs. Normally, there's an application process, and you may have to be interviewed and things like that. So you may have to be selected for that, and your company can explain what that process is. But it's very beneficial because then once you complete that, then they'll be able to place you on a study as a CRA and move you into that monitoring role. Now, it may take them a while to do that based on what their workload is at the time, but that's probably the most direct manner that you're going to be able to use without any monitoring experience to get into that monitoring role. Now, there are also private training programs out there. I don't list any of them here, but if you go and do some searches, you'll find that there are a number of them out there. Some of these range in cost from, they might cost $1,000 up to maybe a few $1,000s. There could be some that are a little less than that. And so that's another avenue that you can take to get into a monitoring program. I'm not sure how effective those programs are in terms of people that complete them, actually getting into a monitoring role, but it's certainly something to consider as you're assessing all of your training options. And then finally, we want to discuss how to assess your progress in expanding your monitoring role. And I've got a couple of bullet items here, and I want to go over each of these because I think this is very important. So the first bullet item I have here is understanding your role as a monitor in your first 2 years. So you should make it a goal within your first 2 years to learn how to conduct the 4 different types of monitoring visits. So that would be your pre-study site visit, your site initiation visit, your interim monitoring visit, and then finally the closeout visit. At most CROs and probably at most pharma companies, there's normally going to be some kind of sign-off process where you're going to have to go and demonstrate that you can conduct each of these visits before you'll be, allowed to go do them on your own. So you should really try and do your observation visits and try and get your sign-off completed on those as soon as you can. That makes you a little more deployable as a CRA, as a monitor, because somebody project manager or a clinical manager that's going to be evaluating you for their project, if they know that you can do all those visits without any additional supervision, then that's going to give you an advantage over someone that doesn't have that designation. The next thing I want to talk about is taking on a senior monitoring role, and by that I mean, as you get into your field, you want to think of yourself as a leader in certain areas. So you want to become a go-to person for your project leaders. And that may be in the area of, say, taking on extra visits, being willing to travel to other parts of the country to conduct visits, being willing to do that on an as-needed basis or on a short-term basis. That makes you very valuable. If you're someone that constantly complains about having to do that, then that's probably not going to make you look very good and not going to help you long term in your career. The other thing to think about becoming an expert in specific areas of monitoring, such as regulatory review or document reconciliation. Understand the process for doing that at your company, and being able to help others learn that process is very important. You might become, kind of a go-to data management person because you really like to, run the reports and run the spreadsheets and, find all the errors and stuff like that. That could be an area where you could really kind of develop yourself as a leader. Understanding the EDC platforms and the IWRS platforms, how they work together. That can help you as much as anything. So becoming a leader in a specific area is very important to helping expand your monitoring skills and make you a more valuable member of the team. The last item there is mentoring new monitors. That's something that's very important. If your company has a mentoring program, you should definitely try and get involved in that. And that means things like, taking new monitors on monitoring visits, helping orient them to your project. Because once you get out there, you're going to be on a project, you're going to be on a study, and you're going to have some staff turnovers. You're going to have new monitors join your team and as others leave. And so they're going to kind of need to be oriented a little bit. And being willing to do that, once again, being willing to share your experience and your knowledge is going to make you a much more valuable asset. So I would encourage everyone to try and do that once you gain a few years of experience. Think about mentoring new monitors that not only come to your company, but also come to your study or your trial or your program. Once again, helps make you a more valuable asset. So we have some reading assignments for this week. From your textbook, I'd like you to read Chapter 21, which is the future of CRAs, and also I'd like for you to look at Appendix A, which discusses some of the resources out there, both online and elsewhere, for CRAs. And then we have a couple of articles here I want you to read. The first one is The Future of Monitoring. I think you'll enjoy this. Then we have another article, Sensible Approaches to Reducing Clinical Trial Costs. You'll find those two on Moodle. And then there's an online article here called The CRA is Dead, Long Live the CRA. I think you'll find that to be a very interesting article. So I'll publish the link there. These are also in your module page on Moodle, so it's probably going to be easier for you to just open up the module page and click on that link in order to get to the article. We have a couple of more articles here. First, we've got The Changing Paradigm of Monitoring and the Evolving Role of the CRA. This is an online article that you can click the link on and get access to that. We also have how risk-based monitoring is changing the role of monitors. And then finally, are delays in clinical trials due to a lack of experienced CRAs? I think you'll find that article to be very interesting. So all of these are normally maybe 2, 3, 4 pages long, so they're not that long. It won't take you long to get through them. But I think you'll enjoy them, and I think it will help you as you go through your online assignment this week. For your online assignment this week, I want you to put on your future hat and plan what you think your future is going to look like. Ask yourself, where do you want to be? And so what you're going to do, you're going to develop a professional/career plan with some milestones at each stop. I think it's important to do that. So I want you to begin with the end in mind. In other words, I want you to think about where you ultimately want to wind up. Is that I want to be a CRA, I want to be a senior CRA with 8, 9, 10 years of experience in multiple therapeutic areas? Or, hey, I want to be a clinical team manager, or I want to be a project manager, and this is kind of one of the monitoring role is one of the stepping stones along the way. Or I want to be a director, or I want to be a vice president. I want to be in executive leadership. What are the things that I need to do in order to achieve that goal? So kind of think in terms of maybe, 3 to 4 year increments. And you're going to use some creativity here. But start by identifying what you need to accomplish at each level in order to move up. And I would start by answering some basic questions. For example, what does it take to get to the next level? Do I need further education? Do I need more training? Do I just need more experience in the role that I'm in? What is it that I need in order to do that? If I'm currently at a CRO and I'm in a regulatory role, or maybe I'm an in-house CRA role, and I want to get to the on-site monitoring role, do I need to go through their training program? Is that something I have to do? And you may want to talk with your manager about that and get some feedback from them. Or you may want to talk to others. It's a very collaborative type process. Ask yourself, do I need to apply for a different role in my company, or do I need to go elsewhere? Sometimes you have to go elsewhere because you kind of reach a limit with the company you're at, and it's important if you want to progress in your career to be able to do that. Ask yourself, how do I take on greater responsibility? What do I have to do in order to do that? I would also include networking, and that includes networking not only outside of your company, but inside your company as well. Is very important. That's why these professional development associations, such as that I mentioned earlier, ACRP, SOCRA, because they meet on a frequent basis and you've got local people involved there, building that network is extremely beneficial for your career benefit. So I highly encourage you to do that. How do I make myself visible? Can I participate in a new project that maybe has some visibility to the upper management at my company? These are all things that I want you to ask yourself. Now, I want you to limit your responses to probably 250 words. Don't feel like you got to write a term paper out there. But maybe you come up and say, okay, well, the next 2 years, here's where I want to be. For some of you, it may be just getting into an entry-level role at a local company might be your first step. For those of you that are already working in our industry, determine what your next step is going to be. And I would encourage you, even after this course, maintain this document and refer to it and use it as a plan to progress in your career. I think you'll find it to be extremely beneficial and very helpful. So I'm eager to see what you come up with on the discussion forum. Use some creativity, put some thought behind it, and really, think about this as something that's really going to help you expand your career.